Welcome to Philly Fortune Talks with your host, Jake Penny, where the city's brightest minds share the secrets behind their success. Are you ready to be inspired?
Welcome to another episode of Philly Fortune Talks, where we explore the journeys of Philadelphia's most innovative and influential entrepreneurs. Today, we are excited to introduce Syed Siddiqi, a rising star in the healthcare industry. Syed is the founder and CEO of the American Journal of Healthcare Strategy, an organization that has quickly become a pioneer in the healthcare administration, with a focus on creating podcasts, video interviews, and public health courses. Syed's platform reaches over 50,000 listeners and viewers monthly, making a significant impact in the field. In addition to his entrepreneurial endeavors, Syed serves as the administrative coordinator for Thomas Jefferson University Hospital's Division of Facial Plastic and Reconstructive Surgery. His practice includes a diverse clientele ranging from international societies and television news personalities to models, actors, everyday individuals looking to refresh their appearance. Syed's dedication to healthcare and his innovative approach have led him to speak at several prominent venues, including the National Capitol Building, the Pennsylvania Capitol Building, and LaSalle University's Health Sciences Forum. Join us as we dive into Syed Siddiqi's journey, his insights on leadership and innovation in healthcare, and his commitment to advancing public health through strategic communication. Let's get started on Philly Fortune Talks. Syed, pleasure to have you.
Hey, thank you for having me, Jake.
Well, I gave a brief background on you. If I missed anything, could you give the listeners a little more of a deep dive or whatnot?
Yeah, no, I mean, you pretty much did a good job going over the background. Basically, I've been working in health administration for a few years now. And within health administration, I collaborate with the medical side of law, and I sort of found that like most of the academic journals that are used in healthcare are directly clinical related. I wanted to create a type of journal that goes over research studies to improve the administration of different programs. I realized there was a hole in that industry over there, so I went with the American Journal of Healthcare Strategy, and the attention that's got is truly amazing, and I'm so grateful to our readers and listeners and viewers. It's truly magnificent how it grew.
So, Syed, your journey in healthcare is truly inspiring. Can you share a pivotal moment in your career that significantly, influenced your path? That was early on.
Yeah. So when I started a journal, it was a little baby project. I didn't expect it to be anything big, I just wanted to put something out there. And we were doing all right with the numbers, and I was pretty happy with the growth. Like I said, I didn't expect anything to really come from it. And then in my email, I see an invitation from LaSalle University. They were having an annual health sciences forum, and in the forum there were other like big names such as Jefferson Health, Penn Medicine, Children's Hospital. These were huge names that were in the forum. So them reaching out to me directly to be an expert panelist on the forum, that changed my whole idea on what was coming. I did not expect that at all. LaSalle University is pretty well known. To be sitting next to representatives from huge organizations and representing something that I created myself, it was truly amazing. And that's when I realized that no, this is a good idea that can actually skyrocket into something even bigger. And from there, I started working towards growing it even more. Yeah, that invitation from LaSalle University's Health Sciences Forum was truly pivotal and game changing for me and the organization.
So what motivated you to found the American Journal of Healthcare Strategy, and what was your vision for the organization when you started?
Yeah, so with that whole gap that I described, I realized that there are a lot of areas where research can be performed to really improve operations, to improve regulations, in every single area in health administration. While working as an admin at Jefferson Facial Plastics, I actually created this whole new process, and it like streamlined the collage creations, which we show patients, saved a bunch of wait time. Um, and from there, I realized I could totally go ahead and like publish a study on this. This could be something that other organizations, other administrators can read and sort of implement in their own programs. Um, I did some more research. I did not really find much in the field, so I was like, hey, why not create something? So I went
Of
ahead
course.
and created a journal to publish different research articles like that.
Yeah, fill a void that's not there that is definitely needed, and you became that solution. So, I mean, your platform has gained substantial following, fairly rapidly. So, what strategies maybe that you use to grow that have that rapid growth? What were they?
So in the beginning, it was me and Cole and Zach. We were pretty much doing everything. You know, we were wearing multiple hats. We were in every single area. Once we were able to take it to a place where it got more recognized in the industry, we've actually had people reach out wanting to join. Um, and from there, we discussed and picked individuals that were already experienced, well established in the industry, um, and sort of had them as mentors, and they're still mentoring us. Their experience, their combined decades of experience, is honestly something that really helped us skyrocket because they own businesses, they work with businesses. Um, I never did any of that. Cole never did. Zach never did. So having their mentorship really showed us what we can do, what needs to be changed, the actual areas of improvement, how to raise our marketing, how to raise our growth. I would say the mentorship was the biggest part. And it's kind of weird because you don't really get to the point of mentorship um, until you're at a point where you're already recognized, and that was the case for us. So the hardest part was literally the beginning when we had to get to that point to be recognized and have mentors come to us to help out and want to get involved.
Yeah, mentorship, is so important. And for anybody listening, get a mentor if you can, one, if you can afford it, or if you're recognized to where they want to be your mentor, because it'll shortcut a ton of time. You gain their experiences so you don't make the mess ups or the mistakes and everything like that. So, that's awesome that you got a mentor that was already doing it in the field and saw your vision, what your mission was, and hopped on board and mentored you. That's great.
Yeah, no,
What's
I'm
a
very.
sorry, go ahead.
I was just saying, I'm very fortunate in that. Got truly lucky.
So, is there any particularly challenging project or period you've had with the American Journal of your journal, American Journal of Healthcare Strategy, and how you overcame it?
Yeah, I would say the biggest part was the marketing side. In a media-based company, the biggest thing is having people actually view your media or like read it or listen to your podcast. Um, the biggest part was actually reaching people and having them keep coming back, recur. If they listen to a podcast, you want them to come back for another podcast. If they read a blog post, you want them to come back and keep following and subscribing to come back to more blog posts. Um, I think the biggest part, I don't think it was an issue of quality. I think our quality has always been there from the start. If anything, got better with the mentorship and with experience. I think the biggest hurdle that we faced, especially in the beginning, was just being recognized, even like appearing in front of the faces of the viewers. A big thing that really helped us in that front was again the experience from people working in marketing. That was huge. Uh, Really collaborating with the readers. Rather than just publishing research articles, we started interviewing a lot of the readers that we already had and their shares, their reposts. Um, that helps us reach a huge amount. So I think aiming for his repost is a big thing. Because once they repost something, now your post is brought in front of their entire connection base. If someone from
Hmm.
their connection base reposts, now you'll open up to a whole new field of connections. So I think aiming for reposts and likes and shares is really the biggest part that help with the marketing.
Yeah, because it's almost like a domino effect. Their audience is now your audience, and then if their audience shares it on their social media, it's like a trickle effect. It starts webbing out, you know. So
Right,
that's
exactly.
good. So a little bit on leadership and management. How has your role at Thomas Jefferson University Hospital influenced your leadership style in running the American Journal of Healthcare Strategy?
Well, at Jefferson, I have some really good mentors there as well. And I'm sort of training under them. There, I have I would say three mentors at Jefferson, and I would say they also have like three different types of leadership styles. So being under them, I can see what an employee wants from a leader, and everyone has their pros and cons, but being able to
Hmm.
the characteristics that all three of them have that I want to adapt and the areas that I don't want to adapt. I think just being associated with leaders on an everyday basis, I think that really grows you to the leader that you want to be because you see the qualities that you want to exhibit. You see the cons that you do not want to give off to your employees. So I would say just the exposure to different forms of leadership, multiple different leaders. I would say that's the biggest part that sort of shapes the way I go about the journal and how I discuss with my coworkers in that front.
Yeah, I mean, it goes to the saying, who you are, who you hang around with, right? Your peer group will shape you to who you are, right? You'll be the average of the five people that you surround yourself with. Like that saying is on been going on and on for probably centuries. I don't know, but I've heard it a million times, and it's pretty damn true. So, surround yourself with winners and surround yourself with leaders.
Exactly.
So when building your team or when you're going to be building your team even bigger, what qualities will you be, prioritizing and why?
Well, the biggest thing is collaboration. Um, in our company, we stress the importance of that, and every day, any project you work on, you're going to have to talk to someone. You're never really running a project on your own. Sometimes you take the lead in projects, which we try to give everyone. I think it's good to sort of feel like you more so have a say and have the power to control how you want something to go. And if it's your idea that you came up with, I think by all means you should go ahead and have full control of the project. But it's very rare that you won't be talking to someone else with the project. So I think teamwork is the biggest thing. We just had internship interviews, and the biggest part was how they demonstrate themselves. A big question that we asked was if you saw yourself, if we were to pay for you to go to a conference or a stage and represent a journal, how confident would you be? And what would you talk about? Why do you feel you'll be that confident? What we're trying to really see is if you're confident enough to sort of be the face of the journal, someone that we want to be the face, someone that can really demonstrate what our core values are to multiple industry leaders, someone that can stand on stage and be able to talk openly. Really, the communication and the teamwork and um, just being confident enough to demonstrate the values. I would say those are the biggest qualities that we look for.
Okay, yeah, I mean that's super super important. But balancing, you said earlier that you wore a bunch of hats in the beginning, you and your partner, and that's typical for any entrepreneur, business owner. Man, we bootstrap the day we get started until the day we don't have to. Or if we like it, we bootstrap till the day we die, right? We have all the hats that we want and that we can handle. And some people love it, but some people grow out of it and delegate it. So like balancing your various professional commitments, I mean, obviously is super demanding. So what daily habits or routines help you stay focused and effective with obviously your role at Thomas Jefferson and then the American Journal healthcare strategy?
Well, it's important to like realize the importance of prioritization, I would say. Working at Thomas Jefferson, and then coming back and having some tasks to do for the journal, I would say that really prioritizing what comes first, what's the most important thing, that would be the biggest thing that should be done first before you can tackle it all. We all wear multiple hats. You can't do everything, right? Um, I would say I'm not the best at marketing. I'll delegate, I'll give my advice, but I'll delegate to the professionals. I wouldn't prioritize marketing over something else that I would be good at. I think it's really knowing your strengths, your weaknesses, prioritizing based on that, prioritizing based on impact, and that's really how you get through the day. If there's something that you're not really able to accomplish, because you can't work 24 hours a day, so if there's something that you can't really accomplish, I think it's always best to delegate that to those that really can and have the experience to do it.
Absolutely. I'm super fond of delegating, because it's like your time is worth, so much more at what you're effective at, what you're a pro at. Delegate what you're not good at because it'll let you succeed and thrive in what you're good at, and then it's also like, hey, your time value is X. Well, if there's things that are less than your time value, delegate them out. Have them done by a third party that you can pay X amount of dollars an hour so that way you can focus on really building the business.
Right.
You said you had mentors. Be outside of the mentors that you have, was there any um, books, podcasts, or courses that significantly influence your approach to your journal and leadership?
Yeah, I think a lot of people stress the importance of competing with your competitors, and sort of like seeing how you can get ahead. And that's definitely important to come out on top in the industry, really grow your followers. You need to know who's your biggest competitor. But I would say that your competitor is also someone you can learn from. Just knowing like different journals in the area, learning from them, different associations, learning from those associations. We're trying to get into accreditation, learning from other accrediting organizations. I would say always be mindful of your competitors, um, but you can always learn from them. See what they're doing. Why are they so? Why are they doing well? Why did they go up one week when we didn't? Really try to learn from them, adapt, and from there you can definitely make a good game plan just based on that knowledge. I would say that's a big area that really helped me, just being aware of the competitors and being able to learn from them. Books in the industry, nobody really wants to hear healthcare strategy from someone that is not even aware of the basics of healthcare, right? So
Mm.
I would say you have to be at least in the know. Since we deal with like interviews, um, we sort of have it somewhat easy because we're sort of asking questions to those that are experts in a certain field. If someone's an expert in pharmaceuticals, we're asking them questions. We're trying to learn. So part of our work is learning. So we really get lucky in that front. Um, but then again, you should be going into all of this with some basic knowledge. So I would say just books, listening to podcasts, videos. I think it's always important to stay in the know.
Yeah, yeah. So you spoke about competitors. You know, what upcoming trends in the healthcare industry are you most excited about that you see on the forefront from competitors or from your own side, and how are you preparing for them?
So the biggest ones that I've seen, and I actually got really lucky because I was able to talk to multiple experts in those in focusing on those fields. A big one, it just uh the evolution of AI. So we got into writing blogs. Now you can just type in a question on chat GPT or something, and boom, you get immediate blog post in like 5 minutes, or not even 5 minutes, like 5 seconds. So I realized that with the evolution of technology, you're always able to um your position is always able to be compromised, but you can also adapt to that. So you could use it to your benefit, and from there you can focus on different areas that need more attention. While, as we were just talking about delegating, you can delegate to technology and use that for your benefit.
That's for sure. I mean, ChatGTP has definitely changed the marketing world. That's for sure, and made it a lot easier to, have pieces of content readily available within a moment's notice at any given time. It's almost like your own personal assistant, that you
Right.
don't have to necessarily pay for. So what projects are on the horizon that you're excited about for your journal? And what are your long-term goals?
I would say a big project that is sort of long term, but I'm like super duper excited about is accrediting. We're trying to look into some accreditation programs, sort of become a body that sort of oversees it, provides a rubric, and really improves the different areas of program. We deal with education, so it seems most logical to go into that, but that's a very long-term project. We haven't even touched the basics of that yet. So I'm looking forward to seeing if that really develops into something, and if it does, how we can go about it to really improve the educational programs. Yeah, that would be the biggest thing. Another one would be publishing books. We haven't really published any books. Um, we sort of have bigger fish to fry at the moment, but once we do get into the publishing of books, I'm really excited to see where that one goes. I think books are very important, especially in a field like healthcare. It's always important to stay informed. Um, Being able to provide textbooks, novels, or even just short pamphlets. I really want to see where that goes.
Yeah, I definitely feel like the accreditation thing is definitely the staple for you being the authoritative figure in your space. Like having that accreditation, having books. I mean, whether it's ebooks or PDFs or physical books, that's you become the authoritative figure in your space.
Right.
So, you know, one other question, well, not one other question, but the financial planning that anybody has, how do you go about it to make sure, one, in your personal life, it's, there's stability and growth, but also for your organization. So that way your organization can keep on growing, because obviously we've, as a bootstrapper or excuse me, a company that's just starting, or maybe it's a thriving company, it's still very important to have some type of financial planning and backing to ensure growth at all times. So what does that look like for you guys?
So as a startup, we're actually very fortunate in that um, we were able to have some backing from investors, which is always big. It sort of gives us a leg up in a way where we can work on big projects, important projects, which require a substantial amount of money that we don't necessarily have. The investors really help us out in that front. Um, Another part is, especially in the beginning, the first month or two, uh, being able to make money and reinvesting it into the project. I think that's very important. Obviously, the details of that is kind of depends on the individual themselves, how much
Hmm.
they make, how much they need to survive without the project, and how much they can really put into the project while not compromising any savings or any other personal investments. I think just being able to figure out that amount that works for you and being able to put that into a project that you're starting. It could be from your basement. You don't need to go ahead and like get an office from the get-go. You can always just work on basement, and as things grow, maybe you can decide, oh, now we're at a position where we can move from a basement to an entire office. I think a lot of it goes into timing and personal circumstances.
Right. Differentiate the needs and wants when growing the business. Like, yeah, we all want this, but do we need it yet? Does our our bottom line support that. If it does, great, go ahead and move forward. But if it doesn't, there's no need for it. You can, like you said, an office in the basement, fine. Hey, but you can still write off that basement as a working space on your taxes. So why not utilize it?
Exactly. Might as well,
Yeah. So what's one piece of advice for an aspiring, healthcare entrepreneur, journalist, looking to make a significant impact? What would you give them?
I would say the persistence is the biggest thing. I know it's been said in the past, but I didn't really realize the importance of that until I was working on it myself. The first month of the journal, we barely got any attention, um, not much money. I'm funding this myself, and we're really working towards it. Second month, we see some improvements, some growth. We get a few reposts going on. Um, and over time, we're able to develop into a place where we don't really have to focus on the numbers as much anymore because the reposts come, the shares come, we get comments, we get people reaching out to us, people wanting to join our team, Um, so I would say the biggest part is persistence. I would never have even guessed that we would have come to a position that we are in now. If you asked me when I started this journal, it's truly great, and I'm very fortunate to really see a seed that was planted, really grow into something that it is now. I think it's truly fantastic, and I'm very lucky to see that happen.
That's great. It's a great story, coming from where you started and you are now. But for any listeners who want to connect with you or learn more about the American Journal of Healthcare Strategy, what's the best place for them to go?
Our website is the biggest place that we direct leads to. We have all our information, all our blog posts, all our podcast videos, all our information is on the website. We also post daily on LinkedIn, Instagram, Facebook. We're pretty much found on most socials. Um, I would say connect with us on LinkedIn, connect with us on our website, and feel free to subscribe.
Awesome. And for the listeners, what is that website?
So that would be www.ajhcs.org.
Awesome, Saeed. Well, hey, it was a pleasure having you on Philly Fortune Talks.
Hey, thank you, Jake. I really appreciate you inviting me on, and it's been fantastic talking to you.
Thanks for tuning in to Philly Fortune Talks with Jake Penny. Inspired to share your success story? Visit phillyfortunetalks.com/guest and let's inspire together.